Like Danny said, I am a pediatrician with children's at the Eagle Run office, and I do have 3 children of my own, and they all gave me their own challenges going through this potty training fun experience, but we will hopefully try to give you guys some good advice tonight as we go through the information. What I'll touch on tonight is just briefly some history about, potty training or different theories. And the theory that I'm going to be focusing on tonight is really more of a child-centered approach. A very important part of this whole process is just assessing that your child is ready, that you are in fact, hitting those milestones that will say that we are ready to get this party going. What to do to get started, what to do when problems occur, and then nighttime is a little different, and again, we'll leave some question time at the end. Mastering toilet training is a very important developmental milestone, and I think you need to kind of look at it at that too, as it's one of the first activities that you and your child may go through in terms of learning a skill and accomplishing something, and this can be actually a fun time if you look at it that way. Your child is at a time during potty training where everything is new. They're discovering what they can do, what their bodies are doing, and this can really be a fun time if you let it. It's a time where you kind of can get to know, how you deal with stress or how you deal with change, and not only that, but how your child deals with change and how you guys can relate to this experience. It's a time, too, where you have a lot of external pressures. I know that this maybe even starts well before potty training, but you see all your friends on Facebook, oh, my child is potty trained at 15 months, or oh, so it took 2 days and she's doing great. So there are a lot of external pressures, I think, that kind of relates to potty training. But it's also a time where your child can really get some, self-esteem. So it's a fun, exciting time, but it's also a very difficult time. And I kind of touched on that a little bit with a conforming to parental or social expectation. A lot of parents feel like a push, a deadline. Oh, I have to get them potty trained for preschool. Or I have to get them potty trained to move up in daycare. And so it can really put a lot of stress, on your family and on you and your child. The potty training also happens to happen at a time when at 2 to 3 age range where they're learning independence and they want to exert their independence wherever they possibly can. The lovely, trying 2s or trying 3s, and that is all happening here at the same time. I really hope that tonight, though, that you'll take away that, trying to keep this positive, trying to keep some of the negative things out of this will really help. If you do have a negative experience with potty training, you can unfortunately have other issues, physical and emotional come up, such as, enuresis, or the inability to actually hold their urine, or having, accidents that are more of a, stress or anxiety related, or encopresis, when they're holding their stool to the point of it really being, painful and getting quite constipated, in a worst case scenario, where there actually could be an abuse, situation if tension is high enough between, child and parent. So again, the approach that we'll be talking about tonight, and there are different approaches out there, but the one that we're going to be talking about tonight is really more of a child-centered approach, where we're really looking to see, is your child ready for this process? Are they meeting the milestones? Do they have the physical, the behavioral, maturation that they really can truly start this process? So we look at, some of the, physiologic or physical characteristics. Can they actually get to the toilet? Can they sit for a minute? Can they, help themselves get, undressed? And do they have the behavioral maturation where they are wanting that independence, or wanting to please you, they're wanting to imitate you? Are they meeting all of these things? And again, if we're kind of making sure that we're meeting these things, that will hopefully, allow the child to go through this with more, less conflict at least. This child-oriented approach is associated with good results. It's a very high rate of success. Can be rapid if you actually look at the time when you're really, when you're really there trying it. And we'll talk a little bit about that. The actual potty training time may be different than the preparation time. That may take a little bit longer. And again, if you wait until they're ready, hopefully you won't have much regression. Now, there always is regression, or I shouldn't say always, but there's always accidents. It's not going to be a perfect process from the very get-go. Just a quick facts. If you look, okay, well, how old are kids when they're ready to potty train? So we're looking at these physical characteristics, which may be different from child to child. But how old is that is a child when they're ready? If you look at statistics in the U.S. And they vary. There are some countries that actually are probably even younger than we are. But this kind of compares the U.S. to Switzerland. And in the U.S. there's a quarter or so that actually around 24 months are ready and have reached some daytime continence or daytime dry. A much greater percent by that 37 months, and I'll kind of talk a little bit later. There's probably a magic window sometime between 27 and 30 months with a lot of kids where they're really ready to tackle this process. And then a majority by 36 months. But that does mean there are some that still, even beyond 36 months, aren't quite ready yet. And then according to, on this statistic, at least you can see that in Switzerland, it's actually quite a bit later. There's really more of a big push between 3 and 4. So on average, U.S. is about 30 months. Again, that 27 to 30 months is probably a good time to start really tackling it. There are a few kids even younger. The youngest thing I've seen in my practice is 15 to 18-month-old, where they legitimately had the desire, the ability, and they were ready to go. But that is much more rare than the most typical toddlers. Just some things to keep in mind, when we're talking about potty training, there's a couple of different things. You have, staying dry, and you have getting your stool in the toilet, and then you also have nighttime, and those may all be different. They may all happen at different times. The daytime bladder control typically is before bowel, but that's not always the case either. And very often, nights, are separate from the daytime. Nighttime dryness is a little bit different than being dry during the day. Girls on average are a little bit earlier than boys, and first children on average take a little bit longer than the second and third or fourth, fifth baby. But again, these are all kind of general statistics. So bedwetting, normal, even beyond that age 2 to 3 when we see kids being dry during the day. So I don't get too worried or upset about any nighttime wetting when we're starting this process. I did say I've had a few patients that were younger, that 15 to 18 months, where maybe they really are ready to go, but I wouldn't push it, on below 2, I wouldn't force the training unless they truly are showing that they are having that readiness, because there is an associated risk of complication if you're forcing it before they're really ready. All right, so let's get to the specifics. So how do we know? When are we ready? Is your child ready? So we're going to be looking at a few different areas, physical, intellectual, and motivational. With your physical readiness, is the child actually aware that their bladder is filling? Are you noticing that they're telling you when they're going? Are they telling you when they have to go to the bathroom? And maybe at first it's afterwards. It may not be, before, but are they starting to kind of communicate to you in some way that, I know something's going on, down here, and I've peed, or whatever word you guys want to use. You also have to have just that intellectual, that brain's ability to actually hold your urine, and that may not, again, come at the same time for all children. So being able to stop the flow, or being able to hold your urine, and keeping things in mind. A 3-year-old bladder can hold about 5 ounces. So we're not talking about being able to hold this for a very long time. You're going to take lots of trips to the bathroom. You're going to be when you are ready to get this going, you're going to be going back and forth quite a bit. And you also want to make sure that they actually have the motivation to stay dry, that they don't like to be in that wet diaper, or that wet diaper. They want to be in clean pants. Some other physical readiness things, not just related to the bladder, but just their gross motor skills. Can they get to the bathroom in time? Can they pull their pants up and down? Do they understand that, okay, just, hold on, for a minute? And if you're also seeing some other, signs, like we actually are dry, for more than a short period of time. So if they wake up from a nap and maybe they're not soaking wet, or they've been playing for a while and you realize, their diaper has been dry here for a while, and that's a consistent thing. Those could be some other signs that maybe they are getting ready to potty train. Some intellectual readiness, and again, this could be different. And again, we're talking about that 18-month to 27-month time range, and I don't know if any of you have kids in that range, but But they aren't always ready to sit or ready to take direction or ready to follow, follow along some simple instructions. So you want to make sure that they're in a good place at that time where they're excited about in being interested in going to the bathroom. They can follow kind of your directions. They even understand maybe where things belong. And we also are starting to have some sort of a verbal communication where they have a word for pee or poop or urine or stool or whatever it is that you guys want to call. Some motivational readiness is that, they don't want to be in that wet or dirty diaper. They want to be in big girl or big boy pants. They want to be that big kid, or they want some independence. It's also nice to be in a more cooperative stage. Again, like I said, those 2-year-olds or 18 to even, 30-month-olds, can sometimes be in those no phases there. It doesn't matter what you say. You may say, hey, you want some ice cream? No. You want this? No. If they're in that kind of a phase, it's probably not the time to start potty training, because they're in that, not necessarily in that cooperative stage where they want to work with you at a task. Another thing to keep in mind, and I don't want you to downplay this either, is your readiness. Are you really ready to tackle, this task? If there are other things going on in your life, it may not be the best time, to put a lot of effort in this. So if you are moving in the near future, if you have a new baby coming, if there's some, relatives coming for a prolonged stay, those things may not be, a great time to really tackle, this, head on. You want to make sure that you're available, because it will take some time. You will need to have plenty of time to stop what you're doing, run to the restroom, have things easily accessible. So again, if you do have one of these things, a move, going back to work, changes in your life, you may want to consider, holding off. Now, holding off doesn't mean that you don't want to expose them to anything, that you don't want to still talk about it or have things readily available, but you maybe don't want to really just dive into the full-blown, okay, we're going to get you out of diapers in 2 days, phase. But you can certainly, still expose them to it, still have, the potty talk going on, which we'll talk about a little bit in a little bit. So again, if you're ready, you have at least one caregiver that can devote the time and emotional energy necessary to be consistent. If you are in the mental standpoint that okay, there are going to be messes, my kitchen floor is going to be wet, or my carpet may be wet. If you know that this is going to happen, then okay, you're ready. Let's jump in. So the child is ready. You are ready. So, how do we start? And again, I would say that preparation is key. Just like, any new skill or anything that you learn, if your child is going to learn to read or learn to play a sport or learn anything, they're not going to know how to do it in 2 days. So this idea of, you can potty train in 2 days, you have to kind of prep them. You have to go through some of those things prior to the start of your actual training. And so really, some of that preparation doesn't necessarily have to start, when, again, we've met all these milestones. Some of that can start even sooner. That can start when they're 18 months old, or they're starting to want to listen to you, read books, or they want to follow you into the bathroom. And all of those things can start much earlier. So even well before you actually start, do the kind of show and tell. So get some of the books out that talk about, going potty in the toilet, or Elmo going potty in the toilet. If you don't mind, have an open door policy. I'm sure many of you have an open door policy, whether you mind or don't mind. So if they're following you in there, you can just talk out loud. Just say, yeah, mommy or daddy, I had to go potty. So I stopped what I was doing and I walked into the bathroom and I sat down and I went potty. Because you may take that all for granted, but if you actually tell them exactly what you're doing, then they'll understand, okay, that's what's going on, that's what's happening here. You can also, make, when it says change diapers like a robot, don't make diaper changes like a really fun attention-grabbing time, because, why would I want to give up my diaper if you tickle my tummy every time and we tell a story and we laugh? Well, that's fun, So now I know that that's okay when they're younger, but when you're really thinking about, okay, it's time to get you out of the diaper, you'll change the diaper, keep them clean, but not a lot of extra positive stimulus. So that way the potty training can be the fun part. The potty can be when we tickle your tummy, we read a book, we make a big deal out of it. The diaper changes, that's boring. You can also start some practice sitting even ahead of the time, and so get a little toilet seat out, or get one of the inserts for the toilet and let them sit on it even in their clothes, or let them sit on it, like if they're naked before bath time, or if they're, in the morning, like if they wake up before you get their clothes on, just so they kind of get used to it, just they get used to sitting on it, they get used to what it feels like. You can certainly start that, again, even before you think they're truly ready. Now, things that you may want to have, though, on hand and ready to go, when you think that you're getting close to being ready, you do really want to get them a potty chair. And some kids do have preferences whether they want to be like the mom or dad and they want to sit in the big toilet, or maybe they want to be like their neighbor who has a little potty that sings when they pee in it, but get something that they're comfortable with, that they're excited about, and make sure that it does fit them. Because if you can imagine being a little child and up on a big toilet and hanging in with your legs dangling off, it's not necessarily the most comfortable way to relax and to really be comfortable with starting this whole process. So get something that's comfortable. If you do get an insert for the bigger toilet seat, get a step stool so they can have their feet comfortably resting. And that's going to really help them relax. And also, even like with having a bowel movement, again, it's going to help them be able to physically pass that bowel movement if they're more comfortable. If you probably don't want to have lots of tight buttons or things that are hard for them to get on and off if you're starting this whole process, because you want them to be able to get those clothes off easily. So for a girl, that may mean like a skirt with just some loose cut a pull up or something that they can get on easily. With the boy, again, the nice just elastic waistbands, or elastic waistbands for everyone, just something that's easy for them to get up and down. You can certainly have some underwear, and again, we won't necessarily say that you will do the underwear right away, but just have something there that you're ready for, when you're ready to kind of do your trial out of the diapers. Pull-ups is kind of up to you. I know they claim to be, the child will feel the wetness, and so they'll be a great step towards toilet training. That has not been my experience, either in the office or with my own children. They're nice just because they pull up and down. That's probably the only reason that they're nice. I wouldn't think that the pull-up is going to actually make them feel the wetness or have them, be any quicker to potty train. Special soaps, wipes, things that, again, make them excited about the whole process. You can certainly get some sort of like a sticker or a chart where they could be as an incentive, if you once you are ready to start going. Targets for little boys, throw something in the toilet that they can aim at, or even little girls, so throw like some Cheerios or something that you can flush down the toilet in there that okay, try to get the Cheerio, or try to hit that. That could be something that's a fun game or a fun incentive. And if you are a family that's on the go a lot, if you're going to be traveling a lot or in the car a lot, considering having something that's actually a travel seat or a portable seat may also be helpful. All right, so we've got the right clothing. I guess I mentioned that kind of a little bit already, like the sweatpants, pajama bottoms, shorts, nothing that's too difficult, and prepare like by example. Like I said, just talking through what you guys are doing. All right, so we've talked about it, we've read about it. We're all, we're gonna give it a try. We're gonna see, are they ready? Can they really do a little bit of this? So if you're I'd say test it out at first. So just if you have a day, it's quiet, not a lot going on. So just try it. So about every 2 hours or so, just go sit on the toilet. See if they go. If they have some success, fabulous. Make it exciting. Like I said, get excited, stay excited. I mentioned being excited. High five, potty dance, sing a song, call grandma, tattoo on the hand, sticker on the chart, whatever you can do that makes this really exciting if they actually do have a success. And you can even get excited just for sitting. Just for sitting, make it really exciting. Some good times to think about scheduling the toilets. Your first sits would be about 20 minutes after a meal. And that, can be a time where you have that kind of natural gastrocolic reflex. You eat, things start moving through. You may even be able to catch a stool that way. If your child is a regular child, and you know what, they have their bowel movement every day at 3 o'clock. Hey, well, let's try it. Let's go sit at 3 o'clock. See if we can't catch that one time. Really try to get them to sit for a while, because it can take a while for them to truly relax, get comfortable, and actually have a success. So if you need to, like I said, make it fun, sing a song, read a book, try to sit there as long as they will let you. And again, excited. So if you've tried this, and it may take you a while, to even have 1 or 2 successes, but if you've tried it, you've taken the opportunity when you can, when you're at home, when things are calm, and you've tried to get them on the potty. If you've had about a week where you have had some successes, and that may not be success every time, but you've had some successes where they are starting to kind of get it, like, oh yeah, I did it. I peed in the toilet. I pooped in the toilet, and you are noticing some more of that daytime dryness, then you could consider trying the training pants or the cotton underwear. And this is a good step where if you feel like, okay, we're ready, then now you're going to really feel the wetness. So that's where they're really going to tell, oh, okay, I had an accident. But I don't want you to feel that they should be forced to stay in the wet clothing or their wet diapers, that's going to be any kind of an incentive, because it really, the negative reinforcement is very often going to come back to bite you. It's really not going to work very effectively. Then they may end up holding their urine, they may feel bad, they may end up holding their stool, getting constipated, and that can really be your worst enemy during this process. Now, if you try this, you try your day or your couple of days, you're just in your big boy or girl pants, and you're having some successes, great. If it's a disaster, if they're wet, more than they're getting in the toilet, that's fine. They're not ready. Go back to the diapers and just keep going with your being excited. Keep going with putting them on the toilet. This is a time where, depending upon the age of the child, where maybe doing an incentive, may be helpful. And there's a kind of a subtle difference between an incentive and a bribe. Like with a bribe, if you don't want to say to them, oh, look, I have this, come on, let's go potty. But you can set it up, say, all right, Jack, we're ready. We're going to do this. So let's make you a potty training poster. And here it is. And when you are ready to go potty in the toilet, and when you go potty in the toilet, we're going to gift you a sticker. And you can talk it up, show it to them, get them excited about it, but then step away. And then now it's in their shoes. So now when they are ready to go, then they can get the incentive. But a little different than constant reminders, constantly saying, oh, I've got it. You can have the incentive available, have it visible. They know what it is. They know what they're working for. But then again, you tell them when you're ready, that's what you're going to get. So, tips to keep in mind, trying to be, positive, loving, understand that they're probably scared and nervous and excited and don't really know about this process either, just like you may feel the same way. So just, be supportive, let them know that it's okay if they have an accident, but you're in this together. Again, trying to keep them in the loose, easy to move clothing, avoid battles. If they're saying, no, I don't want to do it. No, stomping their feet, fine, that's it. We're not going to, it's not something that is worth battling over. Try not to make them too frightened, so like flushing the toilet while they're on it, that can be sometimes backfire, on parents where they are then scared, or nervous of the toilet. One thing you can do, though, which I forgot to mention a little bit earlier with that preparation, though, is when you're changing their diaper, you can change them in the bathroom just so they kind of get used to, okay, this is where we go. You can let them sit on the toilet after they're done, or if they have a bowel movement, you can put the poop in the toilet, let them flush it so they know, okay, that's where the poop goes, just so they kind of get that concept of that's okay, that's where the poop should be. And again, avoid over reminders. You don't want to overdo it. Anytime you kind of overdo something, it seems like that's like their cue, like, oh, okay, they really want me to do this, I'm going to not do it. So, try not to over remind them. In general, I would say, unless you have, it's like the third boy in a line of boys and they're watching their big brothers, probably just teach them to go sitting down first, because that's going to be, easiest for them, easiest for their, them getting used to it. And when they're first starting, they may not necessarily know the difference between I have to pee or I have to poop. And, if the boy is standing up and they have a pooping accident, that can again be kind of a big scary setback where they're not really excited about that. So just for the beginning, just have them sit down. I've talked a little bit about constipation, but it really is something that I would warn you to look out for while you're doing this process. If you have a child that tends towards harder stools or more painful stools, or they're not going regularly, this could be a time where things could really get worse, because they're trying to learn, when is it okay to go and when is it not, and they're holding it. And if they hold their stool for too long, or they get too painful or too hard, then they can really get fearful of using that toilet. If they have one negative experience on the toilet with a painful bowel movement, it really can set you back, because then they're going to think, well, that was terrible, I'm never going to do that again, and then they hold it and hold it and hold it. So really try to be proactive with that, with giving a good diet during this time, maybe even considering not going overboard with the cheese or the milk, which tends to cause the stools to be a little bit more firm or hard. Plenty of water, plenty of fresh fruits, vegetables, just make sure they're going okay. Let's see. So the training pants, you want to use that more once you've had those successes, not as the first step. Once they know what they're doing, they know kind of they're getting a concept, they've had some successes, then we can introduce those the underpants. And again, nighttime and nap training is not going to necessarily happen at the same time as all of this. Now, if you notice that your child is waking up from naps consistently dry, then you could maybe try it out. Or same thing with nighttime. But at first, put the diaper back on them for nap time and nighttime. No need to focus on that when you're just starting. When they first wake up in the morning, remind them to go to the restroom. Remind them to say, okay, let's go try to go potty. Or when they first wake up from the nap, take them into the bathroom to try to go. But don't set them up for like failure or feeling bad if they are having accidents during nap time. So again, like that soil training or the stool training, if you really can find your child's schedule, if they are one that does tend to go with that gastrocolic reflex after a mealtime, whether it's breakfast or lunch or dinner, use that to your advantage. Really try to go sit them in on that toilet, when you may catch it. And they, again, may have some of those fears that, they don't really know what it is that's coming out of their body at first. When they have a bowel movement, they may be worried, like, oh, I'm losing something that is a part of me. So that's where putting that stool into the toilet may actually help, where they realize, nope, okay, that's where it belongs. Poop belongs in the toilet. Poop wants to be in the toilet. Let's put it in the toilet. And to keep those stools soft. I'm going to say that lots and lots of times tonight. A little bit about night training. You can certainly try or kind of, feel things out when you've had some successes and you've been being dry during the day. You can try to limit the your fluids after dinner to about your bladder capacity, which I said was just about 5 ounces, and then emptying that bladder then before they go to bed. But keeping in mind that it's very normal to bedwet even up until age 4 or 5, sometimes even later, sometimes even 6 or 7. And in fact, we oftentimes as pediatricians won't talk about doing any sort of an intervention until at least 6, if not 8. So, don't be, too worried about that nighttime dryness. Nighttime wetting does tend to run in families. There is a thought that there is just kind of a maturity, in terms of making less urine overnight and or even with, bladder capacity. So there just may be some familial, pattern where they just really are not capable of being, dry at night until they're a little bit older. There are some bedwetting alarms, which I'm not going to talk about in too much detail unless someone has a specific question about them later, but that would be one of our first interventions that we would talk about. Again, no earlier than age 6, but that can be a way to kind of wake the child up if they are wet. And again, we can talk about that if people have specific questions. Pitfalls, that people can run into is just starting too early, just thinking that, when they're 15 months old that they pointed to their diaper one time because they were wet and then you think, oh, they're ready to potty train, let's do this. But they really may not be. I mean, certainly take that opportunity to talk about it, take that opportunity to maybe, get a potty chair or let them sit on it, but don't have the expectation that, oh, they're going to be potty trained in 2 months. This is great, we'll be out of diapers before I know it. So, really take the cues from the child, but don't force the issue. Another thing is just not preparing, is just thinking that it's a natural thing, that they should just come by this naturally, that you don't need to really teach them and prep them and expose them, because, this is brand new for your child. They've never had these kind of expectations on them before. So, keep that in mind. The parent getting frustrated, certainly, or the child getting frustrated are, very common pitfalls. And if you get to a point where you are just kind of, knocking your head against the wall, then take a break. If you need to kind of take a break for a little while, come back to it in a few weeks, that's okay. I mentioned a little bit about the difference between a bribe and a punishment, or a bribe and an incentive, So again, with the bribe, you don't want to just keep dangling it in front of their face, like, come on, we'll do it, let's do it. With an incentive, you kind of have it all set up. It's there, but it's in their shoes. When you're ready to earn it, you can get it. And really, really try to avoid punishment. Really try to keep this as a positive reinforcer as best as you can. So what to expect during this time? Certainly you will have wet pants. You will have messes. Very possibly tears from either you or the child. You will have setbacks. It's not going to always go, perfectly. You may think you've got it, and then the next week, all of a sudden, they're having, accidents again. But know that this really can be a fun time. It can be a good experience, and really this time goes by so quickly. I mentioned I do have 3 children. They're 9, 7, and 3.5, and I don't know that I even really remember all of the terrible things when they were going through this. It goes by so quickly. And there were times with my 3-year-old, I thought that he would not be potty trained. I thought, am I really an expert in potty training? But glad to say he did. He made it. I just had to wait. I had to take my own advice and wait for him to be ready. So when you do have a setback, stay calm, stay positive, let your child be responsible, for telling you that they're ready. And again, if you're just up against the wall, if you're done, if you need a break, just give it, cool off. Go back to diapers for a little while if need be. There are a few things where we actually will have more significant problems, where the child is truly kind of refusing, to go to the toilet, where they have, the good bladder control and regular bowel movements, but they just refuse, to use the toilet. And this may, happen off and on. Some things to kind of think about if this does happen, is maybe they were too early, or maybe you tried this too early and they are still kind of young. Maybe something else is going on. Maybe, you and your child, are having some sort of a conflict and they're kind of expressing their frustration in this sense. Some kids will have irrational fears or anxieties. Maybe they did have a negative experience where the toilet flushed like an automatic toilet, out in public scared them and then now they're frightened, or they did have a really painful bowel movement. So some of these things can certainly come up, and that might be what's happening if you do kind of have a really big setback where they're outright refusing. Things that I would, look at again, look at those stools. I would say that's probably the most common reason, is if they do have some sort of a negative experience with passing a hard or large stool. Some kids, just maybe having, a more difficult temperament at the time, where they're just kind of in a more negative mood, or they're just kind of not wanting to go with the flow. Or they're just trying to exert independence. Maybe they're feeling they're having loss of control in some other aspect of their life. So this is something that they can control. So they're controlling, their bowels. So try not to punish, try not to nag. If you have to back off for a little while, that's okay. You can really talk, if you have other siblings or cousins or, other, playmates, you can kind of talk up, how they're doing or how they're going to the bathroom. Get out those books again, or get out the videos, or talk about that, just to try to make it, again, a positive experience. You could also not necessarily, punish them in the sense, but have them be part of changing the diaper. So it's not just like, well, I don't really want to take the time to stop playing, so you can just change my diaper. Well, make them stop playing. Have them go get the diaper. Have them bring it back to you. So they still have to kind of stop playing if this is kind of more of a power struggle that they're going through if they're having that setback. Constipation, again, it's in here like 50 times, but make sure that they're not, getting any problems with hard stools. If you feel like you've done all of these things, there's nothing, I've tried, we took a break, we've tried to make, diaper changes boring, we've made them, stop playing, they're helping me do that, they still won't go back to going to the toilet, and they're over 4, you probably do need to talk to your pediatrician or another, health specialist to see, what is a specific program that maybe would be tailored more to you. So quickly, just the ABCs of potty training. So we're going to A, assess, just make sure that they're ready, make sure that you're ready. B, make sure we've got all that right equipment. We've got the seat that's comfortable. We've got the stool. We've got the big kid underpants. We've, got the wipes. Create the routine. Let them sit on it for a while. Get them used to it. Demonstrate for your child. Go do the potty talk. Talk to them about what you're doing in the bathroom. And unless you really feel like they're ready, maybe don't do the big push where you're really trying to do it until they are about 27 months. Explain the process, foster the habit, make them excited about it, keep it available, get the training pants, handle the setbacks gracefully, because they very likely will happen, hopefully not in a severe way, but they will happen. And then after all that, we'll talk about introduce the night training, and Jay, jump for joy, you're done. I do include some books, for different ages, for the younger children and for some older children, if you are interested. The 1 to 3 is kind of more of your basic, just introduction to the potty. The 2 to 4, there are some of these on here if you are having that fearful child or the child who doesn't want to use the bathroom. It hurts when I poop is one for, again, those children who are just really scared or don't want to poop on the potty. And then lastly, a few suggestions for you as the parents, if you guys have any interest in reading those. And that is it. So I went through it kind of quickly, but there's plenty of time for questions if anyone has any. Yes?
4-month-old up for, like, in the middle of the night to go to the potty. Is that, like, okay or a good idea?
So you said 34 months? Yeah. So she asked if it's okay to, wake her 34-month-old, to go to potty in the middle of the night. And that's kind of, up to you, I guess. If he, is it he or she? He, if he is, soaking wet, like in the morning, or soaking wet when you actually go in there to wake him up, probably not, necessarily truly ready, to go through the night. But if he actually does get by with maybe, emptying his bladder before bed, you then maybe going in before you go to bed, having him go one more time, and that's enough to get him through the night, then that might be, an okay option. I just would just kind of watch what the success is, and is it something that works for you? Is it feasible for you? I would definitely put a pad on the bed, because you never know. There probably will be some times where he isn't completely dry, but that's a reasonable thing to do. Yes.
What do you do if your child doesn't want to wear panties? She can go on the potty, but
sure, so so wants to go on the potty, doesn't want to have a diaper on, but just doesn't want to wear panties. Wants a diaper.
Throws a fit and says, "No, I want my diaper."
But she keeps the diaper dry.
Well, she has accidents, but she.
Gotcha. Well, if the panties aren't an incentive right now, then I guess you probably don't necessarily need to use that as an incentive. But you could even, if you've had multiple successes where she has actually gone, in the toilet and she can stay dry for a decent amount of time, you could even do the nothing from the waist down trial too. Where you have like a long skirt, a long dress. Then that way if she has an accident, I feel it right away. Ideally, then that's a kind of a negative, incentive to want to actually go in the toilet. In terms of then, getting her to transition, to the actual panties, I guess you might have to just find something that, that she likes. Or just, shorts, if she really wants to wear just shorts, if that works, like if she just is for some reason anti, panty, which I have had kids in my practice who don't like the tightness, that tight feeling, of underpants. But, so you doing, but still sticking with, the positive, trying to get her to go as best as you can. I don't know if that answers your question. But if she's outright refusing, and it's just, over and over and over and over again, you may have to just say, okay, we'll back off and we'll try again later when she shows more interest.
I have a Twitter question.
Sure.
The person wants to know that the child will let them know when they need to go pee, but they won't when they need to poop. So what advice do you have for that?
Well, you can, and I don't know if they are then staying dry, but just not getting the stool, the poop in the toilet. And this is it's not uncommon for kids to have one first and then the other. So definitely keep, praising for going urinating in the toilet. Keep that up as best as you can. As far as the stooling goes, then, like we kind of mentioned, you could always put the poop or the stool into the toilet, flush it so they kind of know that that's where it belongs, that's where it wants to go. go. Make sure they aren't having pain when they go. So if that's part of the concern, make sure that they're comfortable on the toilet, that they aren't hanging out, like I said, where it's hard to actually have a bowel movement. Because if they're used to going in the corner and squatting, well, that's how they're comfortable. That's what they want to do. So getting them more comfortable, sitting on the toilet, or actually, going where they can put their feet down and do that Valsalva movement that you need to pass a bowel movement. And you could even do just a specific incentive for pooping. So that could be something, where, if we've really are already dry, but we can kind of establish some kind of an incentive for stooling. One thing that I did with my second child, because he had a similar problem, is we got a poop toy. So he went with me to the store. We picked out a toy that he wanted, something that he could, within reason, he could pick what he wanted to have. We got it. We brought it home, and I put it up on the refrigerator so he could see it, but he couldn't get to it. If he would poop in the toilet, it would come down for 20 minutes. He could play with it. Then it went back up on the refrigerator. So the next time he pooped, it would come back down. He could play with it. Went back up on the refrigerator. So it was there. It was visible, but it wasn't one of those things where, I got it. I pooped once. I'm good. I'm done. I got my toy. That's it. But, so it was a kind of a continual incentive, that did work for him. But so getting some kind of an incentive, for pooping might help as well, if they're still struggling.
Yes, my son is 3, and he tells us when he goes poop. However, he does not when he goes pee.
Okay.
Work if we brought him to the toilet every half hour, or should we stick with 2 hours? Or
you absolutely can try that. I mean, so if he doesn't want, if he's kind of like a busy boy and I just don't want to stop what I'm doing because I'd rather keep playing and pee, you can absolutely bring him every half hour or every 45 minutes, or consider getting a toilet seat that you put near where he's spending his time. So if he doesn't want to stop, if he doesn't want to stop what he's doing to pee, have a potty seat in the kitchen, or have one in in the bathroom. So there's a couple of places where he can stop what he's doing, but not necessarily have to run to the bathroom. But yeah, if he's willing to just do the potty timer too, okay, today we're gonna every half hour we're gonna go try until he kind of gets the concept. Those are some things you could potentially try.
Is there something? I have a 22-month-old, and she'll go for me. She'll tell me when she has to go, but at daycare she won't. She's not interested at all.
At 22 months, I probably wouldn't, force it too much, truly, because if she's going well for you and you are establishing that, habit at home and she's kind of getting the concept, I wouldn't worry too much. I mean, I don't know. Oftentimes daycares, have lots of experience, in potty training. And so hopefully they're understanding and they're willing, to work with her. I don't know if she'll even just kind of, go with the group to the bathroom, or if she'll, yeah. So again, I really probably wouldn't worry, too much about it yet, truly. Keep doing what you're doing if she's liking it at home and if she's having success, and let the daycare just kind of keep doing, what they're doing. And I really think she'll probably will do fine, truly at that age. Yep.
A 2-part question. My daughter's 21 months. Every time she goes, she takes her diaper off.
Yes. That's maybe a good thing.
My son, he'll go. He's almost there. So should I put them on the potty together? He'll use the adult potty, put her on the the kitty potty, or is she ready because she takes her diaper off?
Well, she's showing you one sign. She's showing you one sign that I don't like to be wet. I don't. So it's a motivational readiness, that I don't want to be. I don't want to be wet. So I guess is she showing you the other signs? Is she able to maybe get to the bathroom? Is she able to maybe help get her pants up and down? Is she able to hold on for a minute? Is she able to do all of those things? And if she is, and she's willing and she's excited about it, you can certainly set her on the potty chair. When in there with her older sibling, if you try that and she fights you, though, again, I would say, oh no, we're not completely ready yet, but you can definitely start to expose her. So she's showing you at least one sign that she's ready.
I have a son who will be 4 in December, and I have been trying since December, and my mom thinks I'm confusing him by going back to diapers when he won't do it. He'll have days, like yesterday, he went on the potty for me a few times. Today, he wanted to wear a diaper. And I'm at a loss.
Sure,
I've tried
sure.
incentives. I mean, I've tried the stickers. I've tried
Mm-hmm.
candy. I've tried the Cheerios in the toilet.
Mhm.
A potty watch.
Mm-hmm.
I swear I've tried everything, and I cannot get him to do it.
So he's 3, almost 4 now. Yeah. I mean, how about with the stool? Does he ever go successfully and like poop in the toilet?
There was like a week. Every time he had stool, he would go in the toilet and not in the diaper. And I'm like, oh, good.
Mm-hmm.
And then he just regresses all the time.
Okay. I mean, and as far as you can tell, nothing else going on, like, no constipation, no pain with the potty, no fear of the potty, more just, I don't really want to do it today.
Just defiant.
Okay. I mean, if he, and this is, maybe a little different, than like some of the, like the 22-month-old, or the 24-month-old, who's maybe not quite, ready. I mean, if you feel like he has the, the bladder control, the bowel, control, that he is able to do it, that he has shown you for a long period of time that he can do it, or at least for a week, you could certainly, go back to just saying, okay, we're going to wear, the training pants, during the day, maybe nap time and nighttime, putting the diaper on him, but, and then, and then just you may have some messes. I mean, does he not like to be wet when he's wearing underpants? He could care less. Okay.
He could be wet. He could be poopy.
Okay.
He just. I want to strangle him.
Okay.
I have a daughter who's
Sure.
older than
Right,
me, who's potty
right.
trained, and so I'm like, okay, he's got to get it eventually. It's got to click.
Right.
Just.
Right.
Ugh.
Does he? I mean, so really, I mean, like, so he doesn't care if he's wet. He doesn't care if he stools. You really don't think that he is like having any pain or any other like problems at all. With it, you feel like he does have the, as far as you can tell, he has the, physical ability to hold it and to get it there.
Yeah, because there's been days, like, if we stay home and don't go anywhere, I'll put him in underwear, and he'll go potty every time. And then it's like as soon as evening time comes around, he kind of gives up and he just goes in his underwear.
Okay. I mean, is that is the evening time a common pattern? Like, is that, or not necessarily? Maybe. Okay. Well, I mean, I don't know. I guess if you has there any other incentive that you have, that you can think of that he would go for? I mean, like, I don't know if he would go for, like, if you've tried like the sticker charts, like, and that, if you've ever tried like, like the toy, like having something like there physical that he can see but he can't have, but again, it's not like I do go once and I get it. I mean, I don't know if you've tried anything at all like that to see if that's a better incentive, for him, where it's a continual thing. And it's not like, oh, I just did it one day and I got what I wanted. I have to keep doing it, to get, to keep getting, what I want. That might be, an option. But if you do that, put it in his court. Like, okay, it's there when you're ready. It's there when you want it. I mean, is he being like defiant in other ways right now, or is he struggling with other things? Yeah. So, it may be, that you trying to, just somehow, change, the tone. I mean, so somehow, like, if you are ready to strangle him, like, if you are really frustrated, you may need to, like, just, take a break and not focus on any of those things that you guys are battling about right now. And, like, try to say, okay, I'm not going to think about that. I'm not going to think about anything else that we're battling. We're going to try to change our whole dynamic, how we're relating, make things a little bit more positive, and then have the incentive and maybe see if he'll be ready to do it. Because if you guys are maybe in a power struggle right now with everything, it could be part of the problem too. But yeah, and I'd be happy to talk to you more, later if you want, but go ahead.
Toy thing, if I have it up high but it's in his vision, I'm afraid he would climb and get it.
Gotcha.
Because that's how he is.
Gotcha. Well, you may have to show him it and then maybe hide it, but then have a picture of it, maybe, like something like, where he could see something visual, but it's not like in his reach. But yeah, good luck. But again, like I said, we can talk more if you have other questions. Yeah.
I have several questions from our Mamaha Live chat this evening. The first one is from a parent who's worried about bedwetting. The child is just now 4, but they're wondering, when does it become a concern, and what are signs maybe that it's something more?
So I mentioned it a little bit, in the talk, but bedwetting, really is different, than the daytime. Some children, the minute that they've got the daytime control, they have the nighttime control. Other children, and there's probably a variety of reasons for this. Some of which might be, just bladder size. Some of it might be, again, there's thought that there's just a maturation in the brain. We all make less urine at night. Some kids may start making less urine at night when they're 3. Some may when they're 13. I mean, so there can be kind of a variety of normal in terms of when they are able to hold their urine for that long. At just 4, or not even, 4, I really wouldn't worry about it. I would, again, make sure they're getting plenty to drink during the day, and make sure they get something to drink at night, maybe a little bit after dinner, but try not to give them a, big, gulp or something before they go to bed. Empty their bladder before they do go to bed. And you can kind of tell them it's okay to get up and go potty in the middle of the night. So like if there's a fear, aspect, they just once they're in bed, they don't want to get out. So you can tell them it's okay if you have to go potty to get out, and go potty at night. And along that lines, too, you make sure they're able to get out and go to the bathroom. So they're not in a crib or something. If you have this expectation, like where they can get to the toilet, have a night light in the bathroom, or have it, where they feel safe. And if you start to notice that the child is having more dry mornings than not, then maybe you can try it without the diaper. But if every single morning they are wet, like no matter what, and you're doing all of those things, then I really would not worry about it. We, if the stats kind of are a little bit changed, but one way to look at it is like 1 in 4 4-year-olds is still wetting, so that's 25%, 1 in 5. I mean, so because around that, percentages, if you look at the children and being dry. So, if they get to be more like 6, that's when potentially you could do things like the alarms. And the alarms are a device that you can purchase where it goes into the bed once the alarm gets wet, or once the padding gets wet, the alarm goes off. If you have a really deep sound sleeper, they may not even wake up, but you will wake up. You'll go in, wake them up, go to the bathroom, change the padding, put on a new pad. And the idea is it's kind of a behavioral modification, or where they will learn to wake up before it's wet. And why it works better than just letting them be wet, on their own. Because again, if they're a deep sleeper, they may not really wake up from being wet for an hour later because they're cold and wet and dry. So the alarm is something that is an option, but really not until your child is 6 to even 8. So again, at that age, I really wouldn't worry yet.
Okay. Our other question: how often should parents ask their child if he or she has to go to the bathroom?
If you're in that kind of phase where, okay, we're really going to try this, we got our big girl, boy pants on, it really is reasonable to every even half hour, 45 minutes to go ahead and take them in there if you're going to have those 2 intensive days of really trying it. But I will say you may want to change it, not necessarily ask them that they need to go, but say, all right, it's time to go. Because again, I don't know if you guys have ever asked a 2-year-old to do anything, but you say, hey, do you want to do this? They'll say no, so instead of asking, say, all right, time to go to the potty. All right, let's go to the potty. So, even changing it around a little bit, you may have, more success. And if you are in that phase too, if you're before you leave, because I guarantee once you get in the car or you get somewhere, that's the time they're gonna have to say, oh, I gotta go potty. So before you leave, go potty. Once, as soon as before you, are gonna go do anything, go try to go potty. But if you're again at home, yeah, every half hour, 45 minutes is fine to try.
Okay. And then one more: a child who plays with his stools. What can you do about that?
And I guess I don't know the age or what the scenario is, but if it's a younger child, I would say that you just make sure that you are changing those diapers quickly as soon as you see that they're dirty, getting them in into a clean diaper. If they tend to do it at night or when they're sleeping, onesies, just so they just don't have access to get in there. But I guess without knowing the specifics, other than just kind of limiting access, quick diaper changes, and try I know it sounds very alarming and gross and disgusting to all of us, but the less you react, oftentimes the less that they will react, and hopefully it won't be a lifelong, or not say lifelong, but a prolonged problem. Yeah.
We have a 2.5-year-old, and she likes to try and go potty, but a lot of times when we sit there and try, she doesn't do anything, but then about 5 or 10 minutes later, she'll have a wet diaper or something, and so is there something we could try and get her to really go while she's...
Sure. And I mean, that's a very common, occurrence, and so, I mean, trying to keep her on there as long as you can, so, plenty of liquids, drink when you're really trying to do this, so she's well hydrated, sitting on there for a long enough period of time so she can relax and, realize, oh, okay, I need to go, making her comfortable, there maybe even is a little bit of something about, running the water a little bit, just, calming them down, but keep trying. If you do get that one success, make a big deal out of it. So she realizes, oh, okay, that's what you're talking about. That's what you want me to do. So if you can get the one success, make a huge deal out of it.
Still have the couple of successes, but it's we always miss it. Every time we always miss it. It's we'll do it 10 minutes before, even 10 minutes after she wakes up, and then it's once we hit that car, right before, because I give her a bath and then every morning, so then right after her bath she sits on the toilet for a good 5 minutes, and then we're in the car. I work at the daycare, so, and we're 3 minutes away from it, and it's within that 3 minutes she just pees.
Yeah.
I'm just and she holds it all night.
Yeah.
Has 2 wet diapers during the day, so it's she always holds it, and she has a really good bladder, but it's we always miss it every time.
Yeah, and again, I wouldn't I guess make her make too big a deal out of the act. Her, I wouldn't say accident, but her going in the diaper. I wouldn't make too big of a deal out of her about her missing it. But if she, if you've had some successes, she knows what it's about. I really would just say, wait until she's showing you more of the time that she's ready. Like I said, my third child, the same way. He could have done it well before he did. But I listened to my own advice. I waited until he was ready, and when he was ready, he went. So sometimes it is just, having them have the knowledge, having the equipment all there, and then just realizing, it will happen.
Our son is 32 months old. He'll be 3 in January, beginning of January. And we've only started potty training a couple months ago because I wanted to wait and make sure he was ready. Mm-hmm. And the first week we had 3 days of naked from the waist down, huge success, and then, moderate success when he was, because the babysitter still keeps the diaper on but takes him to the potty, still had moderate success. And then he stopped. And he is absolutely defiantly not interested in the potty. Will not use it. If I tell him it's time to go to the potty, full on tantrum, won't use it for the babysitter. What happened?
Hard to say exactly. And I don't know again if he did have something negative happen, if he is upset about something else, but at his even at 33 months, even though I know you're approaching that 3-year time where okay, we should be getting this, I probably would say he may be telling you, what, let's just back off for a little bit. And you could even get some sort of an incentive presented, so here it is. This is, when you're ready, this is what you can do. So you tell me when you're ready to go to the potty, here's what, you can have. But if we do that, again, it has to be very physical, concrete, right there. 3-year-olds or not even 3-year-olds are not abstract thinkers. They can't think in an abstraction. So it has to be something that's there. He can see, he can touch it. He knows what it could potentially be. And then you may need to just back off, because if it now is just every time it's just a battle, you may have to just back off for a little while, even though I know it's frustrating. Yeah.
I have a different sort of question. So my son's almost 3. He's hardly ever going, but when he does go, there's no man around for him to watch or anything. I'm teaching him sitting down. Mm-hmm. How do I teach him to keep it in the toilet?
You can just teach him to aim. You can just tell him you just got to point it down. That's okay. That's all right. Yeah, I mean, they need to learn that. They need to learn. Like that's where it goes, and that's where maybe like a target, might work. Like say, okay, like here, like what's that? Yeah, I mean, like, again, like, he's going to be a little bit hard for him to know, but just know, okay, that guy, if he can look and say, okay, that's where I want it to go, and it's okay to teach him. He's got to push it down. Totally fine. Now I will say, like with boys, though, something to look out for is if you think their stream is completely off, like if their stream is forked or spraying or it goes like this way, you may want to let your doctor know because there could potentially be something, going on there. But if they have acceptable aim, which, I have 2 boys, they never have great aim, but if they have acceptable aim, then yeah, it's okay to say, point it down.
A quick one about taking the breaks. How long of a break should you?
Even sometimes even just a week or 2 is enough. Because they it's not a daily reminder. They kind of forget about it. In a young child's life, that can seem like forever. So it doesn't have to be like a month. You could even just take just a week or 2. Until you feel like, okay, all right, I'm ready to try this again. And then try it and see if but make sure that they're again that if they are just like in a defiant mode, make sure that maybe things have been a little bit better. Maybe we aren't battling as much. Maybe we're having some more positive interaction. And then you can try it again. You don't, if they bring it up, I guess I would say, otherwise, don't worry about it. Just, do the boring diaper changes. Don't make it fun again, just change those diapers in a very matter-of-fact, boring way, and then, but just don't, if they bring it up, great. Or if you want to say, hey, I have to go potty, I'm going to go potty, that's okay. Or if like they have an older sibling or something, oh, they're going to go potty, you can do that, but not necessarily like on talking about them going.
Mm-hmm. Our daughter's been pottying for fairly well for about 3 weeks now, just up and decided she wanted to do it after starting, stopping, and of course we're also expecting. So my question is when this new baby comes, what's the chance that I'm going to have to do this all over?
Well, hopefully, I don't know how much time you have, but hopefully, if it's gotten to be a pattern or a habit, hopefully you won't have too much of a regression. And again, there may be a little bit, there may be some accidents, but if you try to kind of just not make a big deal out of the accidents either, hopefully you won't have too much of a regression if it's really gotten to be a pattern. I will kind of use them like a month rule, like before like a new baby or a new move. If you can have a month, of it being there before, the change, that's usually enough.
Yep. I have a child and she's only 18 months and she takes off her diaper and she like stands by the toilet and just pees. I know she's initiating wanting to potty, but she's still in that no stage where everything is.
Sure, right.
So is that something I should,
I guess if she's showing you some of the interest, if you want to get like her like a seat where she's comfortable or get an insert where she's comfortable, and like when she's showing you the desire interest, go for it. Let her do it and talk about it and do all that, but maybe don't have the expectation that we're going to get those diapers off. So just kind of do it at her pace. And if she really takes off and she's got it and she's telling you, fabulous. If it's more like, okay, yeah, I'm kind of figuring it out right now, but then next week I'm going to be like, one of these kids over here and I'm going to say, no way, I don't want it. Then don't force it. All right. Well, we're just about, an hour. Thank you all for coming. I hope you got some, useful information. I'm happy to stay around if anyone has any other specific questions for me, and good luck to you all.